as a public health specialist for last 6 years. Dr. Dinesh is a member of numerous national and international technical bodies, including the International Child Neurology Association, which is very renowned association. And his accolades includes the Vadyasri Award from SDM Heritage and Dr. Yela Pragada Subbarao Memorial Award for Best Indian Biomedical Scientist in 2024. The NABS Fellowship for Best Research and Best Second Research Award from European Academy of Ayurveda, Germany. He served as PhD guide at Kerala University of Health Sciences and is a board of study member of at various universities. Dr. Dinesh has published 24 research papers and he has a resource person in over 300 national and international conference. Notable invitations include participation at Stanford University, the BRICS conference in Moscow, and the IUPHAR conference in China. His primary clinical area of focus are pediatrics, cancer, and infertility, while his research interest lies in the microbiome. पर्सनली आई नो डॉक्टर दिनेश और हम लोग जोधपुर के केबीकॉन कॉन्फ्रेंस में मिल चुके हैं और ही इज़ वेरी एनर्जेटिक एंड एंथुजियास्टिक स्पीकर always with a smiling face and very dedicated and he is so busy person always on webinar and always indulge in so many conferences. So it is very difficult to get appointment from him. And he is doing some extraordinary work regarding the autism. So it is a great day for us that today's speaker is Dr. Dinesh K.S. and we are eagerly waiting for his talk. And we are going to really benefit it. So I invite Dr. Dinesh K.S. For his nice talk today. Welcome, Dr. Dinesh. Please start your talk.
Namaste, sir. Am I audible?
Yes, sir.
Yes, yes.
My respected senior dignitaries, Dr. K.N. Upadhyay, sir. Then Dr. Dinesh Kumar Rai, sir. Then all other M.N. Gupta, sir, and all other respected dignitaries and my dear friends. First of all, I am basically the South Zone coordinator of this Vishwa Ayurveda Parishad. But hardly, I feel we could conduct hardly very few programs only, it seems. In South, there was no such programs had been conducted. And so our humble request is that let us have some more works on the Vishwa Ayurveda Parishad, and we should have some common social media groups for the coordinated works. And all we know, we are struggling with the new syllabus, both UG and PG. A lot of glitches are coming. We need to put it in an easy way according to the spirit of National Education Policy 2020. All this can be very well coordinated with this Vishwa Ayurveda Parishad, Kaumarabhritya, or otherwise Vishwa Ayurveda Parishad group also. And it's my privilege to be with you in this evening by stealing my 1 hour from my family time during the Sunday. And let us discuss today regarding the neuromotor disabilities. And right now, can you see this slides. Can you see the slides? Somebody please.
Yes, yes,
Yes,
yes, yes.
So I will take hardly 1 hour of time. Management of neuromotor. Motor means there are two motor organs in our human body, muscles and glands, out of which mostly we are encountering the muscular issues connected to nervous system. So I am specifically sticking upon management of neuromuscular disorders in children. And generally, almost all the neuromuscular disorders are, its onset is genetics. But there are a lot of heterogeneous group of diseases affecting basically the components of the motor unit. Motor unit means there will be anterior horn cells, there will be peripheral nerve, the neuromuscular junction and muscles. These are the motor unit. And this motor unit is affected with lot of clinical conditions. This is the picture of motor unit. Everybody know anterior horn cells. These are the nerves and neuromuscular junction. And here I am primarily sticking upon the muscle, the diseases of the muscles. So muscles, then this neuromuscular junction, peripheral nerves and anterior horn cells. Of course, I will also deal with the static disability like a cerebral palsy. So they can be classified into two. This classification is little bit, it is not purely academic classification. According to the new UG syllabus, right now almost my work is completed. According to the new UG syllabus, one book will come from my side in this December itself. In that also, I kept this type of clinically oriented approach rather than highly academic approach. Like these neuromuscular disorders can be classified into two, like early onset and childhood onset. I'm giving certain examples like early onset, like cerebral palsy, all of you know, myelodysplastic syndromes, several spinal cord issues, sacral agenesis, arthrogryposis multiplex congenita, lot of syndromes like Marfan syndrome. All these conditions are showing early onset neuromuscular problems. In cerebral palsy, it is a static problem. And in all other conditions, the neurological deficits expressing in the muscles. In case of childhood onset, that means after 1 to 3 or 4 years of age, there are onset of several diseases like a Charcot-Marie-Tooth disease. Otherwise, we call it as a hereditary sensory motor neuropathy. SMA, all we know, it is a fatal disease many a times. Congenital myasthenia gravis, fatal disease. Muscular dystrophies, basically they are not neuromuscular, this is primary muscular, but I put it deliberately for muscular issues. Then Frederick's ataxia like conditions. So these are the primary classification. One is early onset, in which Bidhatma Karmasya Kala dosha, Madhustadahara Vihara dosha, Kurvandi dosha, Vividani dushta, Samsthana Varnendriya Vaigradani is expressed properly in all these conditions. However, Jatajaha, Swapacharal, Sandarpanaja, Apatarpanaja, such a type of Jataja problems, mainly along with some sort of Garbajaha problem are mixed in these conditions. But why I kept this classification? Because according to this classification, if you are looking at the problem, you will get good treatment options. That I will give you certain differences. Childhood onset problems, all those are progressive. Progressive in the sense they are, as the age advances, they are increasing in problem. It means that they are either Vatika or Paitika in nature. They are not static. If it is static, mostly Kabhajam, Sthira Samvidhanam, Sthira Gunam. But here it is Kayatmaga. Kayatmaga is usually Vata Pitta dominant. And they are impairment of motor functions like Prasarana Gunjanayo Pravrti. Gati Prasarana Gunjana, Nimesha, then Utshepana, Vatshepanadi karma will be impaired. Often reduces the life expectancy many a times. Majority of them will not celebrate 25th birthday. There are certain diseases they will live up to even 60 years of age, but will be crippling. So the quality of life will be impaired in many cases. Here, early onset are mainly, most of them are non-progressive. They are non-progressive means they are static in nature, more Kapha Vadiga type. Here, Vada Paitika type. Better prognosis, many times they are manageable too. Anterior horn cells involved diseases like spinal muscular atrophy. The management is very difficult. Related to zero. Zero is dying very early. One is also death is very consistent. And 2, 3 are highly manageable. Krugenberg-Welander disease, all you know, Werding-Hoffmann's disease, all these are very difficult to manage. But still, in type 2, type 3, very successful management are available. I will discuss with you how I am managing with that. Peripheral nerve complaints like Charcot-Marie-Tooth disease, CMTD. Otherwise, hereditary sensory motor neuropathies. But as this disease is highly progressing one, but with successful interpretation of the disease, we can manage it very successfully. And neuromuscular junction, congenital myasthenia gravis, for example. All we know in the diagnosis, differential diagnosis of floppy baby syndrome, we can see a lot of conditions, around 20 to 25 conditions are there, out of which congenital myasthenia gravis. As this one, Charcot-Marie-Tooth disease is very successful to manage, and spinal muscular atrophy is very difficult to manage also. So I am not putting much examples in that case. Everyone can treat, but I will give you certain guidelines. In congenital myasthenia gravis, for example, the child will be perfectly all right during the initial time. Gradually, the child will show bilateral ptosis. Then later on, the child cannot walk. Previously, the child used to walk, but later on, gradually, the child will reduce their walking capacity. For example, this is a child
from this age, I got this child. Right now, she is grown up. Right now, you see bilateral ptosis is prominent. Here also, bilateral ptosis is prominent. But you know, she cannot walk properly. And this is the hyperextended joints she has. But right now, you know, she is improving a lot with improved ptosis. This is her jumping. But she cannot jump that much. She cannot jump that much because why? Because of her inability to execute her motor functions. But she is improving. Usually, all these are the reels from her TikTok, no, from her YouTube. I downloaded. My point is, usually with conventional allopathic medication, they cannot treat it successfully. They have a lot of options like steroids, as it is an autoimmune condition, is associated with this. But we can treat it very successfully. I will discuss with you what are the treatment methodologies. Similarly, Friedreich's ataxia like a condition or ataxia telangiectasia like a conditions, you know. For example, this child, the child cannot walk properly due to the ataxia. And this child is from Tamil Nadu. And ataxia telangiectasia is a rare autosomal recessive neurodegenerative disorder. As the age advances, the child is getting more and more troubles caused by mutations in the ATM gene. Usually in between 1 and 4 years of age, the disease is starting. Cerebellar ataxia will be the first symptoms: gait unsteadiness, frequent falls, tremor, dysmetria, dysarthria, telangiectasia. See, all we know, in case of Pakshagadam, Grihitwardam Tanorvayu Siras Nayur Vichoshecha. The reason why, because I am specifically pointing out this point, is that many Ayurveda people are committing lot of mistakes in the management of such diseases. Whenever the Siras Nayu is simultaneously affected, Sira is Upadadu of Rektadadu, Snayu is Upadadu of Medodadu, Rektadadu is in need of Shida Guna Pradhana Chikitsa, Medodadu is in need of Ushna Guna Pradhana Chikitsa. The very same dushyas can be seen in cerebral palsy, but the Rakta Pradosha Vigaras are very, very, very few in cerebral palsy. But here, the Rakta Pradosha Vigara of telangiectasia, dilated small blood vessels visible on bulbar conjunctiva, ear, face, and flexural areas are so common, and it is highly alarming too. Because if you are not judiciously planning our treatment, it will be very difficult to treat such cases. The case will worse. The beauty is that with our treatment, initially there will be an improvement. Whenever you are goes on doing the treatment with Atyushna, like Taila Parishekam and everything, the condition will worst. So this should be kept in mind. That child is right now grown up. Now he can walk like this. Literally there is no ataxia. Even right now he can walk with in single line. On single line he can walk. Now there are several diseases. You might have seen Arnold-Chiari malformations. In Arnold-Chiari, the total brainstem or the cerebellar region will be bulged through foramen magnum. And there will be difficulty for motor functions like jumping, walking, and this is one child. The child is unable to even stand up whenever we are instructing it. Due to the bulging of the cerebellum, she is put on soft collar, because if you are removing the soft collar, the brainstem will be jammed and she will be get into the ICU. That is the usual pattern what we see. And here you see she is walking with a lot of difficulties on the parallel bars. But right now, without much difficulty, she can walk. Since the last 2 years, she has not seen ICU. So, my point is, in all neuromuscular progressive disorders and non-progressive static disorders, you can see following symptoms. Either there will be hypotonia, kapam vadam, and majority of the dosha is kapam, sladhangata, sindhi chaidilyam, shidila sandhi mamsatvam. Prasarana gunjana pravritti will be showing the kaphavarana. The vyana vayu is affected with the kaphavarana. In hypotonia cases, you should give maximum ruksha karma. And in hypertonia case, probably they will show hypertonia either in the form of rigidity or spasticity or contraction. They are kapam vadam. More vada dosha is predominant. So probably you might have, you should give more snigdha procedures. Otherwise, there will be wasting. Wasting is again 3 types. Number 1 is Kevala Vadigam, very difficult to get it clinically. Number 2 is Vada Paitigam, it is common, which is in need of more Pitta Shamana treatment, not Atyushnam, but Kshira Pradhana treatment, Grida Pradhana treatments. Then Kaphavadiga wasting is present in case of congenital myasthenia gravis, as I shown you before. Kaphavadiga type of wasting can be seen, in which Rucha Karmada will give good result with the wasting. So you should make an Upashya at least for 7 days. Only then you will be able to find out. At least for a beginner, it will be very difficult to identify which wasting is. Associated feature will help you to identify whether it is Kevalavadiga, Vata Paitiga or Vata Kapacha type. Otherwise, you will see the children with a lot of movement disorders like tremor. That's also present in case of progressive degenerative type of diseases like, for example, you can see tongue fibrillation in spinal muscular atrophy. Otherwise, there will be a problem in the coordination that is called as ataxia, as we seen in the case of Kalaya Ganjam, Kanjade Gamanarambe, Kanjanivacha, Kambade Gamanarambe, Kanjanivacha Yoyadi, Kalaya Ganjam Tam Vidyan, Mukta Sandhi Prabandhanam. That type of presentation may be the presenting complaint. Accordingly, we should plan the treatment. Only then this type of successful outcome will come. And always keep it in your mind that all these are affected with the Sirasnayu. There are several diseases in which the Dusya Sira is more prominent, as I shown you, in case of ataxia telangiectasia. In such scenario, we should be highly cautious while doing the Ushna Tishna treatments. In cerebral palsy like a condition, all we know, either hypertonia, hypotonia or movement disorder will be the presenting complaint. So hypertonicity is always spasticity, rigidity or contraction. Contraction is the permanent deformity in which You can do a lot of things instead of surgery. Kapha, Vata, Sira, Snayu, and Mamsam sometimes will be the Dushya whenever the wastings are present. And these are the different terminologies associated with the spasticity, Kubjata, Stabdatvam, Kunitvam. Kunitvam means Sanganam Vakratvam, Kubjatvam, Makriyavatvam, Stabdatvam, Makriyavatvam. Vata in hypertonicity is actually doing lot of Sangam, Sadam, Vartanam, that is hardening, so that the child will suffer from lot of such issues. In a hypertonic baby, Sthairiam and Chiragari is the Kapha-dosha Vigrita karmas, Sthairiam and Chiragari. So these are the different other dushyas, mostly related to Vayu, and spasticity has to be managed by Kapha-Vadahara treatment, more attention to Vadiga dosha. And hypotonia has to be managed with Sangam, Sadam, Chiragari, and they are Kapha-Vadiga, more attention to Kapha has to be given. So in Kapha-Vadiga condition, hypotonia has to be managed with more Kapahara Kapha-Vadiga management. Hypertonia, that is spasticity, has to be managed with Kapha-Vadahara, more Vadahara treatments. In movement disorders like ataxia, athetoid movements, seizure-like things, there will be Akshepaga Vadavyadi style of presentation may come, in which either they will be Kevalavadhigam or there will be Kapha-Vadhigam. That will come to know only after having a detailed Upashaya and Upashaya observation. For example, if it is a tremor, you do Yavakola Kulata Churna Udvartana initially for 5 days. If the movements are increasing, okay, we can assume that it is going to be Kevalavadiga. But at the same time, if you are doing the Abhyanga, then also there will be an increase of tremor sometimes, or the movement disorders. Again, that is also Kapha-Vadiga. But at the same time, if you are doing Udvartanam with Shashtika Churnam, probably there may be a reduction, or there are sometimes with Abhyanga, there will be a number of reduced movement disorder. So these are the 4 major observations that you can see. Accordingly, you have to plan whether it is Kapha-Vadigam and Kevalavadhigam. If it is reduced by Abhyanga, it is purely Kevalavadhigam. But if it is reduced by Shashtika Churnam, that is more Kapha-Vadigam but more Vada dominant type. If it is reduced by Yavakola Kulata Churnam, Kapha-Vadigam or Kapaja type. So these are the different observations that you can see. We should study properly what is Snayu. Snayu is in our context, at least in this context, Snayu is nothing but nerve, because if we are collecting all the references regarding the Snayu, Snayavaha Shanagaram, it is thread-like structure. Snavanam Navashadhi, it is 900 in number, the most numerous, distributed all over the Apata Siddham, it is distributed. And Nahyastini, Navapeshu, Nasira, Nachasantayaha, Vyabadida, Yadahanyus, Tadasnayur, Jadidinam. The pathological impact is maximum harmful impact will be contributed by Snayu. Whenever Vayu is situated in the Snayu, Gridrasi, Ayama, Kubjata, convulsive disorders, Akshepaga Vadavyadis are tetanic postures are produced. So this is nothing but Snayu, is nothing but the neurological lesion. Stabdata is neurological lesion. So Snayu is nerve. So main points to be remembered, Kapha-Vadiga problems are we are dealing, out of which maximum attention to Vada in hypertonia and movement disorder, and maximum attention to Kapha to the floppy baby, and Dushya whenever it is coming as Sirasnayu, we should be very cautious, as we seen in the case of ataxia, telangiectasia. In degenerative case, mostly degenerated tissues are Sira, Snayu and Mamsa, more Vata Pitta dominant. In that case, we need to do Vata Pitta Hara treatment, like mostly if it is Pitta dominant, for example, in case of telangiectasia, we should give the Dashamula Chiraparishekam, Shashtiganda Lepanam, and Jadamayadi Churnam, Udvartanam. All those are the different types of management that has to be adopted. And if the Sira is severely involved, like telangiectasia and Kawasaki diseases, post-Kawasaki neuropathies, and in the initial phase of Guillain-Barré, in all such cases, we are not supposed to do any of the Ushna Trishna treatment. Similar to the Vadarakta treatments, we should follow it, like Dashamurashira Parishekam, then Bahalastwalevo Upanaha, like the thick leba with Jadamayadi has to be put all over the body, and let it and make the packing with the blanket, and give this Guru Pravaranam Swedam, that is Anakni Swedam, Guru Pravaranam Swedam. So these are the different types of Sweda procedures that has to be given. Then in static case, of course, you can have the Kapavada dominant, Sirasnayu, Mamsa will be the Dushya. In such cases, you can have both Rutrana and Snehana alternatively. Why? Because that I will give you in cerebral palsy like management. Initially, you should give certain days of Rutrana so that the kapha will come down, and next you have to give the Snehana so that the Vata will come down. In Kapavadiga, Rutrasita can be alternatively given according to the permission of Charagacharya Swedadhyaya. The usual medicine what we are keeping in degenerative cases are more Pitta Shamana, Vata Shamana, Vata Pitta Shamana type, like Belaguluji Adi. Belaguluji Adi, Belaguluji Surapunnaga. Only 3 drugs are there. Very powerful medicine, but while giving this Belaguluji Adi, you should keep it in mind, this is very lazy drug. Vata Pitta Haram, Sirasnayu, Astihidam, and Rekta Dhadu is also one of the trust area of Belaguluchadi, and this is very lazy drug. Mandaguna Pradhana drug. Probably, if you are getting fresh pipali, not the dried pipali, because dry pipali is always Pitta Vardagam. Ardra Pitta Prasamani, Shushka Pitta Pragopini, that is the pipali gunas. Okay, so if you are adding Ardra Pipali Kalkam 1 gram along with Belaguluchadi, that will give wonderful results. Mind it, please don't add Shushka Pipali Prayoga. I am giving examples. You can have a lot of other options like, Dashamula Rasnadi Kwadam, which is Dashamula Rasnadi Gridham is mentioned in Vadiga Kasa. If you are preparing Kwada out of it, that is very powerful medicine in this aspect. Then Bela Punarnabadi Kwadam. Then you can have this Dhanundaran Kwadam. All these are very powerful in degenerative cases. Maharasnadi, whenever Pitta component is low, but it is Vada Vaitigam, and we need more Vada Shamanam, then Maharasnadi Kwadam is ideal. Maharasnadi Kwadam beauty is that you can't imagine It is powerful in Vadika Shobha. And it is a powerful medicine in sleepatam, in elephantiasis, even though it is a Brahmana Dravya. So such wonderful clinical indications and good results are available with Maharasnadi. Then primary Guluchyadi. In case of Frederick's ataxia, the Guluchyadi is the first drug of choice in my clinic by looking at the Pitta dosha as a Jwara paracetamol nyaya. Without looking anything, I blindly prescribe Guluchyadi initially for 10 to 21 days. Later on, after having a lot of treatment and a lot of these Tiktapachana Dravyas, you can shift it to the Kalyana Gagruta, Ashwagandha, Gotshura, Punarnava, Kapikachu. These are the different drugs what we are using. Mind it, unless and until if you don't remove the Amatva, otherwise Srodo Vaigunya, otherwise Srodo Roda, otherwise Pittavrtavayu, by these medicine and treatment like the Chamula Chira Parishega, Jadamayadi Udvartana, or Shastika Churna Udvartana, or otherwise Behalastwale Bobanaha, by this, if you are removing the Pitta dosha, Pittavrtavata, after that, if you are continuing this medicine, that will be powerful. Otherwise, if you are directly giving, that will be giving negative results. But at the same time, if you go for the static conditions like a Kapabadika condition, like cerebral palsy, or as I told you, the myasthenia gravis, hereditary spastic paraparesis, or otherwise hereditary sensory motor neuropathies, the diseases are Kapabadikam in nature. In that situation, you can give the Ashtavargam, Adari Sahajarati, Sahajara, Suradaru, Nagaram, and Adari. Adari, I don't know synonym of it and Latin name I forgot. Adari Sahajaradi, it is available in Kerala market. Reswanadi is very powerful if you are damn sure that there is no Pitta dosha anubandha, because Lesuna is highly contraindicated in Pitta condition. Pitta rekta vinirmukta samastavarana vrute, Lesuna indication. So Pitta rekta vinirmukta होना जरूरी है. So Resonadi is a powerful medicine in all such cases. Villuadi Lehyam, Sahajaradi Kashayam, Bhadradarvyadi Kashayam. These are the usual medicines for the Kapavadika conditions we are applying. And in degenerative condition, mind it, the following points. The conditions like SMA, the conditions like Charcot-Marie, this CMTD, Charcot-Marie tooth disease. You know, the directly given Anubhashaya, directly given Snigdha procedures like Abhyanga, Taila Parishega, Shashtakachali Pindasweda, whatever may be the Snigdha procedure, if you are giving it directly, it will give Anubhashaya. Either in short time or in long time, it will give Anubhashaya. But whatever may be the Ruksha procedure without Pittagopam, like Dhanyamla. Dhanyamla will give Pittagopa chances are there. So except Dhanyamla, whatever may be the Pitta Shamanam Ruksham will give you, always will give you Ubhashayam. Whatever may be the degenerative diseases, it will give you Ubhashayam. Too much Ushnam, like Daila Parishegam, Patra Potala Swedam, like Nali Swedam, that will also give you Anubhashayam in long term, in long run. So my point is, please don't opt Snigdha procedures initially. You can have the Ruksha procedures initially. Don't put the child on too much Ushnatama, in Taratama Ushnatama treatment, like Pidinu Tadavel or the Thaila Parishekam or the severe Nali Svedam. That will give Anupasayam. Too much Snigdha is Anupasayam. And mind it, in almost all the degenerative conditions, if you are giving any Vishahara Dravya like Nisha, Sirisha, Villuadi Guliga, Dushi Vishayati Guliga, you will get good results. It is due to Dushi Visha, or you can have the Garavisha Sambrati in it. And the peculiarity of Dushi Visha, Amasi Asto, Kapavada Rogim, Pakwashi Asto, Ailabita Rogim, and finally, all the Dadu Pradosha Vigara, Stidam Rasadi Swadavan Vijitran, Karodi Dadu Prabhavan Vigaran. So, all the Dhatu Pradosha Vigaras can be produced by Vishahara, means Doshi Visha. So, in every chronic disease involving this type of degeneration, you should suspect some Doshi Visha and give Vishahara Dravya while treating these degenerative diseases. Then, third one is Medhyam. Today, I don't know how many of you are member of one of my WhatsApp group, that is Learn Ayurveda with Dr. Dinesh K.S. If you are a member today, I have posted one report from different scientists in it. If you want to be in that group, that is not a pedagogical group. It is only discussion group. That is simply we are discussing something. That's all. Every cell in your body is listening to your mind. Every cell in your body is listening to your mind. What you think shapes what your body produces. Stressful thoughts trigger stress hormones that can impact your health, while calm, positive thinking releases compounds that promote healing and well-being. My point is, cell is the basic unit of life. Cell is the basic unit of life. And if cell is damaged, its mana, buddhi, atma axis is damaged. Its mana, buddhi, atma axis is damaged. So always in a degenerative disease, try to do one Medhya Dravya. The most powerful Medhya Dravya which I have ever seen in degenerative diseases is nothing but Mantuka Parni. Only after that this Ashwagandha comes. Mantuka Parni. Mantuka Parni is the least explored medicine in Ayurveda. Many people other than in Ayurveda are using Mantuka Parni with a lot of clinical implications like acne vulgaris, wound healing, skin, cosmetics, and a lot of other Kapha Pitta Hara therapeutic benefits are being tapped by many people other than in Ayurveda. Then static problems like cerebral palsy, Vata Kapha, Snehana and Rutshana. For Vata, Snehana, for Kapha, Rutshana has to be given. Swedana is both for Vata as well as Kapha. So, Stotana is impossible to eliminate the doshas. Sthana Samsraya is at Sthayi Dhatu in the conditions like cerebral palsy. But still we are giving one course of Yoga Vasti not to increase further Vata aggravation. But you know, the Vata elimination is impossible, but management of Vata and Kapha simultaneously by doing alternate snehana and rutshana is ideal. If you are giving only rutshana, that will lead to vata vruddhi. If you are doing only snehana, there will be kava vruddhi. Go for alternate snehana and rutshana karma. Moreover, to develop neuronal plasticity. I don't know. Many of we people know the neural plasticity. We can mold new neurons from our brains, unused areas, according to our wish, by giving several stimulation. There is a complex mechanism behind it by mediating N-methyl D-aspartate, NMDA. That is the chief neuro chemical which is mediating the neuroplasticity very well. So my point is, if you are going for this alternative snehana rushana, that will give contrast stimulus, and that is very powerful to generate the neuronal plasticity. Usually our package is like this: 3 days rushanam, 3 days snehanam, and that will constitute for that will go on for 24 days or 31 days. One admission in every 6 months. Now it is again I am reducing one admission every 4 months. We are giving at least 3 courses has to be given if the child is less than 4 or 5 years of age. During the snehana time at 10 a.m. there will be an abhyanga and a matravasti. At 3 p.m. there will be a full scalp shiropichu. There will at 4 p.m. there will be snehapanam. At 5 p.m. there will be nasya. Pradimarsa nasya matam. These are the different snehana procedures. Alternatively, during the rushana procedures at 10 a.m. there will be an udvartanam, or otherwise dashamula dhanyamala podali swedam or dhanyamala parishegam, etc. 3 p.m. there will be shirolebam or talam. 4 p.m. madhutagapanam or gugulupanam. 5 p.m. pradhamana or dhamana. These are the rusha karma. Because we are doing shamana chikilsa, we are doing vicharana chikilsa. So yukthyabacharayel sneham bhattyadi annena vastibihi nasya abhyanjana gandusha murdakarna akshitarpanehi. My point is, these are the different portal of snehanam. The very same portal can be used for rushana karma also. So if you are doing the alternative rushana and snehana karma, that will give good results. This is Snigdha procedure during the snehana days. This is Ruksha procedure, Dhamana Nasyam. There is a pipe attached to a bulb. If you are pressing that bulb, the powder will reach the nasal cavity. This is the full scalp pichu. What we are doing. And for the spasticity, and these are the Ubanaham. In Arkapatra, we are making the paste of Vimlabana Dravyas. Vimlabana Dravya, Vimlabanam is a tissue softening method used in Shalyatantra, and the very same Shalyatantra in Sutra Samhita does not mention what are the Dravyas has to be used for Vimlabanam, but in Ashtanga Sangraha it is mentioned. Those Dravyas are collected and they are used for this fibrolytic activity for this bandage, this Upanaham, and this is very good for spastic joints. So in degenerative condition, Natyushna Nadisidam, Nosnigdam, Duksham, Medhyam, Vishaharam is the treatment principle. These are the different methods what we are giving for degenerative Belaguluchadi, Villuadi Guliga or Doshi Vishadi Guliga. Then Manasa Mitra Batakam as a medium, Udvartaram with a Shastika Churnam or Jadamayadi Churnam. The maximum therapeutic efficacy is available with the Dashamula Kshira Parishekam, Abhyangam, Shastigana Lebanam, Rachanyadi Avipatti Ashwagandha combination. Legu Brahmanam is the treatment of choice. Mahisha Dravagam, I don't know how many of you are getting this product. In Kerala market is available. This is Mahisha Asti plus Maharasnadi Kwadam Arkam. It is Legu Sandarpanam. It is good for Asti Sirasnayi Vikaras. Yabanavasti, Ashwagandha, Muhur application. As this Samprati is going towards the Prana Vayu, so Muhur application of Guduchadi, Shatavari, Ashwagandha, Jeevandi, Gochuda, at least once in a week. That is Muhur means from 8 AM to 8 PM, 1 hourly, 1 tablet each. My point is the use of complementary and alternative medicine in children with common neurological diseases is not unique to India, but it is happening everywhere. This is one of such Korean Journal of Pediatrics publication, and these are by several Chinese and Korean people, authors. And if you are going to the Middle East also, there are a lot of complementary medicine are being used for pediatric neurology patients. And the point is 82 to 85% of the global population are seeking for alternatives. Otherwise, the parents of neuromuscular problems and neurological problems are eagerly waiting for something. The 85% of the parents are eagerly waiting for something. So do all the treatment not by achara but by yukti grida. Use your logic and have the treatments. Thank you. By this I am winding up. Thank you for the opportunity. And as this is a Sunday, I cannot spare much time. So is there any quick discussion is needed? Please give me a quick question. If it's so, I will give you answers. Otherwise, let us go to the wind-up session. Okay?
ओके
Any quick?
धन्यवाद सर।
जी, जी.
मैंने लोग जितने जुड़े हो उनको मैंने बोला हुआ, यदि किसी चिकित्सक को कोई क्वेरी हो तो चैट बॉक्स में ड्रॉप कर दे मैसेज।
I will share my link to the group. So if at all any discussion is needed, you can come.
डॉक्टर ऐश्वर्या, आपको कोई क्वेरी? डॉक्टर ऐश्वर्या?
Yes, sir.
Yeah.
I just wanted to ask regarding can we give Sneha to in the form of Pana and Matravasti simultaneously?
Yes, Matravasti, don't be Snehavasti. Snehavasti and Snehapana cannot be joined together, but at the same time, Matravasti can be given. So, the dose of the Matravasti at the time of Snehapana should be highly judicious.
Okay, okay, thank you, sir.
डॉक्टर माधव प्रिया।
I am texting my group link to join, and if needed, you can. There are near about 980 members in that. Let us discuss many cases in that if needed.
Yes, interested student can join WhatsApp group Learn Ayurveda via Dr. Dinesh K.S. So they can join WhatsApp group. And I think any more question, Dr. Pankaj?
नो सर, मोर क्वेश्चन हो।
तो
इसी क्रम को आगे बढ़ाते हुए दिनेश सर को आमंत्रित करता हूँ कि कार्यक्रम के वोट ऑफ थैंक्स। डॉक्टर दिनेश सर।
हाँ, यस, थैंक यू डॉक्टर दिनेश के.एस. हम जो है 2 बार आपसे मिले थे, 2013 में एसडीएम आयुर्वेदिक कॉलेज हसन में सीएमई प्रोग्राम में, जब आप नए यंग ब्लडेड थे, लेक्चरर थे। उसके बाद जो हमने कौमारकोम किया था 118 में किया था, और दूसरा
स्टिल ही इज लुकिंग यंग।
और आप जो है लेबोरियस कैंडिडेट रहे हैं, अच्छा है। मैं पुनः आपको धन्यवाद देता हूं कि आपने अपने नॉलेज को शेयर किया। हमारे लिए थोड़ा सा ये अलग है, हम सीपीआरटीज में एडीएचडी में स्नेह नहीं करते हैं, लेकिन आपने जो रुक्षण अल्टरनेट बताया वात कफ के कारण, तो उसको हम अप्लाई करेंगे। और मैं उम्मीद करता हूं कि आपका ज्ञान जो है हमारे जो यंग ब्लडेड पीजी स्कॉलर हैं उनको जो है ज्ञानवर्धक होगा। आज जो है 42 कैंडिडेट ने भाग लिया था, और अच्छा है, इसी तरह ज्ञान का आदान प्रदान होवे। मैं इस वेबिनार में भाग लेने वाले डॉक्टर के.एन. उपाध्याय जी को, डॉक्टर एम.एन. गुप्ता जी को, डॉक्टर पंकज कुमार सिंह जी को, और जितने भी एचओडी हैं आपके पूरे भारतवर्ष में, जैसे प्रोफेसर बी.एम. सिंह जी, डॉक्टर निशा ओझा जी, प्रोफेसर कोरी जी, प्रोफेसर राकेश शर्मा जी, प्रोफेसर एस.डी. शर्मा जी, प्रोफेसर गिरिराज गर्ग, आपके मित्र प्रोफेसर अमित कटारिया जी, सभी को हमने इनवाइट किया था ज्ञान के आदान प्रदान के लिए। उन्होंने प्रत्यक्ष या परोक्ष रूप से जो है शेयर किया, उनको मैं धन्यवाद देता हूँ। इसके साथ में डॉक्टर सुनीति, डॉक्टर पूजा, डॉक्टर रमिता पवार, डॉक्टर हर्षल दोषी, डॉक्टर प्रकाश, डॉक्टर ऐश्वर्या, सभी को मैं धन्यवाद देता हूं जिन्होंने अपना अमूल्य समय दिया। हमारा एक ही उद्देश्य है कि जो मेरी नई पीढ़ी आ रही है, जो पीडियाट्रिशियन हैं, वो जो है ज्ञान का आदान प्रदान करें, क्योंकि आजकल जो है प्रैक्टिकल ज्ञान पर ही विशेष ध्यान दिया जा रहा है। थ्योरी तो बात छोड़िए। डॉक्टर साहब ने एक बात और अच्छी कही कि आप जो शास्त्र में लिखा हुआ है उससे हट करके चिकित्सा कीजिए, और शास्त्र और आचार्य भी यही कहता है कि युक्ति प्रमाण का बुद्धि पश्यति या भगवान बहु कारण योगदान। तो आप युक्ति प्रमाण दीजिए, और युक्ति जब आएगी जब आप अप्लाई करेंगे, आप अपने ज्ञान को अप्लाई करेंगे, और जब हम प्रैक्टिकल करेंगे तो अपने आप युक्ति आ जाती है। मैं पुनः पुनः आप सभी लोगों का आभार व्यक्त करता हूं। आप लोग इस वेबिनार में सम्मिलित हुए। अगले मंथ में पुनः एक हमारे जो भारत के मूर्धन्य कौमारभृत्य के विद्वान हैं उनका लेक्चर करवाएंगे, रिक्वेस्ट करेंगे। इसी के साथ धन्यवाद, पुनः पुनः धन्यवाद। थैंक यू सर।
धन्यवाद सर। जैसा कि कार्यक्रम का स्वरूप है कि कार्यक्रम की समाप्ति से पहले हम शांति मंत्र पाठ करते हैं तो हम सभी एक साथ शांति मंत्र का पाठ करेंगे। ओम सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। धन्यवाद। आप सभी को शुभ रात्रि।
शुभ रात्रि। थैंक यू डॉक्टर पंकज।
धन्यवाद सर।
थैंक यू।
Please
Thank
remember
you.
my name properly.
धन्यवाद,
Don't
धन्यवाद।
forget it again.
थैंक यू सर।
बिल्कुल सर।
थैंक यू। शुभ रात्रि सभी को।
जी सर, धन्यवाद।